towards the camera. So I'm kind of back in a fashion. I've been not exactly cleared to do manipulations by the surgeon, but I can do some things because just kind of depending on what I'm doing. So I have Molly here. Molly is my new med student. She has not seen me do any manipulations yet, but I wanted her to kind of see what I do, how it feels, and then hopefully she'll see me do some on some patients later on. So are you having any pain anywhere?
Right side.
Right side, where?
Right about here.
So Molly was telling me a second before this that she had some scoliosis. And have you turned this way? So when you have scoliosis is really hard. So what scoliosis is a curvature in the back. You can have levoscoliosis, you can have thoracoscoliosis. There's just different kinds of scoliosis that you can have. But so like when I'm looking for scoliosis, I generally start in kids, but you feel along the spine and you see where the spine starts to curve. Yours isn't really too bad. Bend forward for me. Like you're gonna touch your toes. Okay. It's easier to feel the spine this way. So I'm feeling down the spinous process and there's a little bit of a curve. Do you know what degree of scoliosis it was?
Not very much.
That's okay. Scoliosis will always have a degree associated with it, and that's how we determine like what the treatment is. For most scoliosis, there isn't a treatment. It's really just doing stretching and strengthening and those type of things. But I found that manipulation can be helpful. So we're gonna start here up at her first ribs. I'm gonna come over to her spinous process, come over here to the thoracic process. So that's what I'm always feeling, Molly. So I'm feeling the spinous process and then feeling the transverse process. He's here. I said thoracic, I meant transverse. And so like I can feel right here, there's an issue. Like, can you feel that difference on you? How it's like probably a little more painful here than here when I'm pushing?
Yeah.
So that's an area of issue. And there's an issue here. You were saying you feel it on your right side?
I feel it on the right, but...
Right in here.
Yeah.
Okay. So a little segment right here. And so when I am looking at her, kind of looking at her hips, and I can see this hip almost looks a little bit higher than this does when she's standing. It's very minimal. You might not be able to see it on video. I can see it when I'm looking at her. So I'm going to come around here to where your PSIS is. And so that's kind of like these little protruding parts here. Go ahead and you're going to bend forward like you're going to touch your hips. There we go. Okay, come on up. So you got something going on with the hips here. So I'm going to have you lay on your back. You want to take your hair clip out. So over your head. Yeah, I'll take your hair. Okay, so I'm going to come over and I'm going to feel on the front of your hips. So your problem side was this left side right here, okay? So it might feel a little painful when I'm pushing here versus this side. Yeah?
A little bit.
Okay. So on this side here, it is superior. And so her hips are rotated like this. It's rotated forward, okay? So I also look at how is her leg moving compared to this side. Pretty even. It's not too bad. I'm gonna bring her leg up. Kind of just see how she moves. See if there's any restriction there. And there's not really. Scoot a little bit over to my side here. So we're gonna bring your leg off the table. Good. I'm gonna put my hand over your hip right here. You're gonna take your knee and you're gonna push it up against my hand. Good. And relax. And then we're gonna do it again. And relax. I'm gonna bring your leg a little further out, a little more down. Go ahead and push up again. Good. Okay. Bend here. Bend here. Good. Go ahead and you're going to push your knees in together. Good. Now go ahead and pull apart. Good. So you can actually kind of see that this knee is higher up than this knee. Okay. Can you see that on yourself?
Oh wow, yeah.
Yeah. Go ahead and push it again. Push, 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 push. Good. Pull apart. Good. And then you're going to push it again. And then pull apart. It's a little bit better. And so this isn't completely fixed, and so it could be something that's going on her back or her sacrum, but I typically start with the hips just because I find that fixes a lot of back things. Take your glasses off and then you're going to flip around onto your stomach. Take the glasses for you. So I'm going to move to her sacrum. Right over here. So this is the base of your sacrum right down here, okay? And then we're gonna come a few inches down. And these are my 2 screening points. And so she has, what do you have going on, Molly? Okay, you're gonna lay on this side for me. And put your legs together. Bend your knees forward. Okay. Bring up. And so I'm bringing up point of resistance here. Push your feet down to the table. And stop. Push down on my knee. Good. And bring your knees forward a little bit more like you're bent. Yep, perfect. Where was that pop at?
Hip.
Okay. Go ahead and push down for me. Good. Go back onto your stomach. Oh, that's better. Yeah. And so that could be a result of many things. Some of it could have to do with her scoliosis. Some of it could just be a variety of other things. So you definitely have some tightness in your low back here. So I'm gonna look at those spots that I found earlier, right up here. So this one actually feels a bit better. You jumped a little bit. Does it hurt?
Yeah.
Okay. So I'm just gonna do some myofascial release, and I just want you to take some deep breaths. And so I'm pushing my palm on her paraspinal muscles while she's taking good breaths. And as she's breathing out, I'm pushing down a little bit more on those paraspinals. Good. I'm feeling it start to relax a little bit. You feel that at all? You feel
Yeah.
it's relaxing a little? Good. Good. And so now I can push and she's not flinching at me. All right. All right, I'm gonna have you go ahead and sit up. Yep, take that one. Okay, I want you to bend forward. Okay, come on up. So she gets worse in extension. So I'm gonna put you a little bit into extension. Turn her to the right. So I'm doing a muscle energy technique. You're gonna take this shoulder and you're gonna turn it to your left. Good, good, good. Stop. And I want you to try and extend your back a little bit more. Good. Go ahead and push. Stop. And then go ahead and extend again. Like try and push it back into an extent. There we go. And then one more time. And stop. You done chiropractic before?
Yeah.
How does this feel compared to chiropractic?
It's less popping, more muscle.
Yeah. And it's hard to describe the difference when patients get it. It's like you can't really describe it until you've actually had it. Stand up and see how your back feels. See if that feels any different to you.
Oh yeah, well, less tight.
Good. Fabulous.